Okay, how about right now?
Yeah, everything is good now.
Oh, okay.
All right. Can you see my screen?
Yes, I can see it.
What can you see on my screen?
NCLEX prep
Okay.
future RN PN review.
All right. Okay. I just want to be sure that we are saying the same thing. All right. So let's get started. Now, is this our first time on Zoom or I've spoken to you on Zoom before?
When that's the second time.
Oh, okay. All right. So now, right, we're about to go on the journey of what? Passing the NCLEX exam, right? My goal for you is to make sure that you end up passing the NCLEX exam, passing in 85 questions.
Mm-hmm.
Now, um, let me pull up something real quick.
Mm-hmm.
What's your what's your email address again?
My address,
Your email.
Frances FRA. You want me to type it for you or what? In the chat?
Yeah,
Let me type.
Can you type it? Well, let me just
Yeah,
check my mail. Maybe I can get it.
1979 at gmail.com.
Okay, I've seen it already.
Yeah,
I've seen it. All right.
yeah.
So, yes, as I said, right,
Mm-hmm.
um, before, right, you sent your test report to me, right?
Yeah.
And the test date was 07/03/2024. This
Mm-hmm.
was your last exam.
Yeah.
All right. Now for RN, it's just like this. Okay, let me give you the whole explanation so that you know where we are coming from. Now, to become a nurse, you need two things. You need to complete a nursing school program and you need to
I
pass
did
the
that.
NCLEX. Right. Yeah, I know. But I'm just trying to tell you, you need two things to become a nurse. Right.
Mm-hmm.
To pass your nursing school, like graduate from nursing school and then pass the NCLEX to become a nurse. Right. Now, nursing school is going to give you knowledge required to attempt this exam so that you can end up becoming a nurse. Nursing school
Mm-hmm.
don't automatically make you a nurse because nursing school just give you the knowledge to become a nurse. So they give you knowledge to become a nurse. You still have one exam you need to take to show that you are ready to now become the nurse. Right. So now the issue right here now is that we need to fix this because this is what is standing between you and your license, the NCLEX. Right. So we need to fix this now. We need to pass this now. So next thing now need to understand is the NCLEX itself because
Mm-hmm.
you now need to understand the NCLEX. Now, this is the NCLEX. So let me give you the NCLEX understanding. So now NCLEX understands something about you. NCLEX know that you have your nursing school knowledge, right?
Mm-hmm.
Because when you are done with nursing school gave you all the knowledge you need in order to attempt the exam. So NCLEX is expecting you now to have every nursing school knowledge necessary to pass the exam. But
Mm-hmm.
NCLEX wants you to do two things. NCLEX wants you to use this nursing school knowledge to show that you can practice as a nurse and also show that you are a safe nurse. Now, the aspect of practicing, right? NCLEX practice cover 8 clients' needs. Why? Showing that you are a safe nurse require you to utilize or understand the six concept. Now, when a student failed the NCLEX exam, what they see on their test report is this 8 client need, because NCLEX is trying to do analysis of how you perform within what this 8 client need. That is the reason why a lot of students will see their report showing above, near, or below. Right, because NCLEX is trying to tell you within this practice area, we have 8 practice area. This is how you performed, right? That is what the NCLEX says. You will not see 6 concepts in what your test plan, but NCLEX is testing you on these 6 concepts. Now, let me give you an example how the NCLEX works so that you understand before we talk about the below and all that kind of stuff. Now, let me clean up. Remember I said NCLEX wants you to use your nursing school knowledge to show that you can practice and show that you are a safe nurse, right? So the practice cover what? The 8 client needs. And then showing that you are a safe nurse is all about what? The 6 concept. Now, the 8 client need, we have management of care as part of it. Now, this is how the examiner writes the question. Now, the examiner will look at the 8 client need. Each client need have contents. So the examiner will look at the 8 client need, decide to test questions from one of them. Let us say, for example, management of care. Now, when the examiner decides to test you on management of care, so the examiner will not think about it and say, okay, let me test this student on management of care. So under management of care, what content should I test this student? So the examiner might not say, okay, let me test this student on what? Advanced directive. So now, this is what the examiner wants to test you. Now, the testing style, we cover what? Any of these 6 concepts. Because this is what the NCLEX want to test you to show that you are a safe nurse. This is the practice area. This is the safety area. The 6 concept. How do you show that you are a safe nurse? How can you handle advanced directive? NCLEX can test you anything in regards to the 6 concept. Now, the 6 concept, we have caring, we have communication and documentation, we have culture and spirituality, we have nursing process, we have clinical judgment, and lastly, we have teaching and learning. Right. So now, since the NCLEX writer decide to test your management of care and select a particular content of that management of care, which is advanced directive, the examiner will now decide, should I test this student on the aspect of caring, or communication and documentation, or culture and spirituality, or nursing process, or clinical judgment, or teaching? NCLEX can select. So this is how the examiner writes the question. So that's why I tell students, when you are studying for the NCLEX exam, now you know the content that will be tested on the exam, right? So now when you are studying the content, be studying the content alongside all these concepts, because NCLEX will test the concept. So instead of just studying the content randomly, follow the concept, because this is how NCLEX writes the question. Advanced directive might be tested in form of caring. Advanced directive might be tested in form of communication and documentation. Advanced directive might be tested in form of culture and spirituality. Advanced directive might be tested in form of nursing process. Advanced directive might be tested in form of clinical judgment. Advanced directive might be tested in form of teaching and learning. That is what you need to know. Now, let's talk about how the content come up. Before I even talk about the content, let me just add this. Now, if if NCLEX is testing you that advanced directive, right? Most especially NCLEX might, okay, let me give you an example now. Let us say now, the NCLEX is testing you on advanced directive, right? Advanced directive. Now, one of your answer might be communicate. Okay, let me give you the question first. Now, the question might be a patient who was admitted with what? Stroke, right? They'll say a patient who was admitted with stroke and they have what? Advanced directive. NCLEX might ask you, what is your nursing action? So now we are trying to take action to what? The advance directive. One of your answer might be communicate to the health
Mm-hmm.
care team members, right? Might be
Mm-hmm.
communicate to the rest of the team member, or one of your answer can be document the advance directive in the client's medical record, right? So you can see how it work, right? You can see how it work.
Yes.
Now, this communication is testing this. This documentation is testing this. This is one of the concepts. So I'm just giving you a clue of how the NCLEX uh, work, right? So now, let's go to the aspect of the content so that we know why the content is very important. Now, when you are done with nursing school, right, you've learned thousands of knowledge.
Mm-hmm.
Now, this knowledge is what the NCLEX expect you to have, right? So the NCLEX know you have thousands of your nursing school knowledge.
Okay.
Now, at this point, they know you would be feeling overwhelmed, worried, concerned because you are like, you don't really know what will be on the exam, right? You are like, oh, I don't really know what will be on the exam. What the NCLEX test me? I'm not sure. I'm not this. I'm not that. So that will be your concern now, right? So NCLEX understand that concern. That is the reason why NCLEX want to give you a focus studying. And that focus studying is what gave birth to the NCLEX test plan. Now, in this test plan, it contains everything you need to know about the NCLEX exam, but most especially the content that will be tested on the NCLEX exam. Right, the content. Now, this is very important to us because now that we know the content that will be tested on the NCLEX exam, it now make the work easier for us so that we can successfully pass in 85 questions. Unlike, guess what? Take for instance, we don't know the content that will be tested on the NCLEX exam. Trust me, this is what we are going to be battling with. Thousands of knowledge. Because we did med surg in nursing school, we did pharmacology, pathophysiology, a lot of courses, anatomy and all, right? So we are going to be battling with that knowledge because we don't know what will be on the exam. So the process will be overwhelming. But NCLEX don't want the process to be overwhelming. That is why they created this test plan to explain the exam and give you the content. Now we now know what to read. Now,
Mm-hmm.
the RN have 146 content. So now, instead of focusing on 1,000 content knowledge, right?
Mm-hmm.
Instead, we are now focusing on what? 146 contents.
Okay.
Now, this 146 contents, that is what I'm now telling you, right? That I, you know, you join my program now, right? So this is how we now utilize it. Because now, when you join my program now, I told you that it's an 8-week program, right? So
Yes.
4 weeks for the content. Now, the content is what? 146 content. You are going to be covering 8 content per day, right? So we are going to be done with the content in 4 weeks. Now, the next one is 2 weeks, right?
Mm-hmm.
Now, for these 2 weeks, we are doing what? Question. At
Okay.
this time, I expect you to be meeting what? 60 to 90% pass rate in every question I'm sending to you. Now, if you can achieve this, I feel like you are ready and you are good to go, right? Because you can easily
Mm-hmm.
use content to answer your question on the NCLEX exam. So the last 2 weeks, right,
Mm-hmm.
I'm going to teach you what? Strategy. Now, this strategy, I expect you to now meet up. If we start answering question again, I expect you to meet up 75 to 95% passing rate. This
Mm-hmm.
way, I can easily tell you that 100% you are going to pass the NCLEX exam if you can achieve this. Right. So this is the whole goal. Now, the content is the biggest part because you need the content before you can answer question or even apply strategy. If you don't know what the NCLEX is testing, you cannot apply any strategy. If you're applying strategy, it make no sense because what are you applying strategy to? Because you don't know the content. Now, the problem with a lot of students is that they don't know the content. That is why when they see the NCLEX question, they are lost. They don't know what the question is testing. The first thing you need to do is to understand what the NCLEX is testing. Now, a lot of students don't know that NCLEX question is broken into 3 parts. A lot of students don't know that. Now, let me tell you about the 3 parts of the NCLEX exam. We have 3 parts, right? We have the body, we have the stem, and then we have what? The answer keys.
Key.
Right. So the body of your question contains the content. This is how NCLEX wants you to think. That's the reason why a lot of students don't know how to interpret question. The first thing that you need to look for in your question is, where is the body of my question?
Yes.
That is the first thing you need to look for because if you have followed my 8 weeks program, right? Remember I said the first 4 weeks is for the content. So if you follow my 8 weeks program, you would have understand every necessary content, which is 146 content, right? You would have understand every necessary content. So that way, the first thing you are trying to do to every question is to spot the content NCLEX is testing. Now, the moment you can spot the content that the NCLEX is testing, now, the next thing you are looking for immediately after spotting the content is what the examiner is asking. Because after the content, right, the examiner question comes in. That is the reason why I teach students the 3C, the 3 key things that make you pass the NCLEX exam. 1, you need to understand the content. You need to know the content. You need to know how the NCLEX writes the question. And lastly, be able to understand the question. So after the content, the aspect is in my course program, I will be training you about what? How the NCLEX write the question, the STEM. Right. So you are not going on the NCLEX exam to now start thinking about how what is the NCLEX testing your what is the NCLEX saying when they say this. Instead, you are going to the NCLEX exam this time around already knowing what the NCLEX is saying. Now, that is the STEM because we need to study the STEM. We have 62 commonly tested STEM over and over again on the exam. You are going to see the same exact STEM on your exam as well too. Now, the content is this 146 content. That's what NCLEX is testing, cannot change. Now, when you have a perfect understanding about the content and what the examiner is saying, then you have the ability to answer the question. So this is now your answer keys where you apply audio principle of answering question in order to select the correct answer. So this is just the principle of understanding the NCLEX. So if I see my NCLEX question, what I always used to do is to say, oh, where's the body of this question and what's the NCLEX testing? So I spot the body, I ask myself, what's the NCLEX testing? All right, from 146 content, this is what the NCLEX is testing. Right, so I look at the STEM, what is the examiner asking me in regards to this content? It's just like now, if I see that the NCLEX is testing me on hypertension, remember, there's a lot of things the examiner can test me in regards to hypertension. The examiner might say, okay, let us test this student on sign and symptom. The examiner can say, let us test this student on medication related to hypertension. Let us test this student on complication. There are a lot of questions that can come out from hypertension, right? So, but if I don't read the STEM that contain the examiner question, I cannot know what the examiner is testing. So, you know the content, you know what the examiner is testing, then you have that ability to select the correct answer. So this is how the NCLEX work. So throughout our 8 weeks program, this is what we are going to be doing. Now, you have to do the job. The reason why I'm telling you right now is because your last test, we need to improve on that. Because, yeah, on the NCLEX exam, you have 5 key important areas on the NCLEX exam. That is management of care, safety and infection control, right? Reduction of risk, physiological adaptation, right? Pharmacology. These 3 areas are so important. They make up 73% of your exam. So if you do well in this area, you are guaranteed to pass. Now, in addition with the other two key area, is it two key area or three? Three, which are your chart type question, case
Mm-hmm.
study,
Mm-hmm.
and bow tie. Then you are
Mm-hmm.
good to go. Now, for your case study, you had just one above the passing standard, and the rest below. You had two below, or three below, I mean, and two near.
Mm-hmm.
This we need to work on that because you need to have at least three above the passing standard here. Right.
Okay.
Now, for the main areas, your management of care you had below the passing standard, your safety and
Mm-hmm.
infection control you had below the passing standard,
I
your
know.
reduction of risk you had below the passing standard, your pharmacology you had below and you have below. So it's not possible to pass the NCLEX exam this way because these are 73% of the exam. And even the remaining 27% of the exam, right, which is your basic care and comfort, health promotion, and psychosocial integrity, your health promotion you had below, your basic care and comfort you had below, your psychosocial integrity, you your psychosocial integrity, right, you had near. So out of the all eight client need I listed, this was the only place you at least wanted to go above the passing standard. Now let me show you about above, near, and below the passing standard so you understand. Now the passing standard for the NCLEX exam, the passing standard for the NCLEX exam for RN is 0.00 logit. In a sense that this is your scale and this is 0.00 right here.
Mm-hmm.
Right. So
I'm below the graph.
okay, great. Now, this part is below. Anywhere, let us say this part is somewhere here is near, I mean, and then here is above. Right. So to be below, you need to like break down this scale right here to be below. If you are here, you are near, but you are not what? Above. If you are here, you are above. So your near is here. So it's not even going above the scale, but it's just near, meaning it is closer to the scale. So this is not a result we want to have, and this is not a result we want to have. We want to stick to this result. We want to stick to this result in the five most important areas on the NCLEX exam, and that other three key areas as well too. I mentioned chart, bow tie, and case study. So you have a lot of work to do. You need to be committed to it. You need to do it. You need to understand. You need to ask questions. You need to answer the question. Right. You need to show up. You need to be attentive to everything I'm saying. You need to jot. You need to listen. Right. You need to like write that information so that you can study it. You need to do everything. And now, one key thing is that we are not rushing to take this NCLEX exam.
No.
You would you are going to take the NCLEX exam when you are ready to take it. Right. When you have
Oh.
audio information. It is better to take time and pass the NCLEX exam than paying the NCLEX more of your $200. We are not about to do that. Right.
Mm-hmm.
So yes, the reason why I have helped more than 700 plus students pass the NCLEX exam successfully is because of I only accept people that are committed. Right. And one way you've shown that you are committed is that you already paid to join the program. Right. And you've paid to join the program. I will not still say, okay, I will leave you to decide how you want to handle the program. I'm going to hold you accountable for every action. Right.
I
So
need that. I need somebody to push me.
okay, yeah, I'm definitely that kind of person that will push you, right? Because I'm going to push you, make sure you do everything possible in order to pass, and you must pass, right?
Yeah, I have
So
to
that is it.
pass.
Yeah, that's it. Any question?
Okay, my question is what day you are going to work with me?
Yeah,
I
we should talk about that because the last time we did not talk about that, right? So, but you can let me know your schedule. You know, I told you it's morning, right? And in the evening. So the
Okay,
coaching
okay,
program is morning and evening.
okay. Let me like okay, like Sun. If I don't know if you go work with me on Sunday because I'm off Sunday, Monday, and Tuesday.
Yes, you
The
told me
rest
that you are off on Sunday,
Monday
Monday,
and
and
Tuesday.
Tuesday.
That's I can work. Like I can do in the afternoon. That's 3 days.
Okay, so
And
you want to do 7 p.m. all these times?
yes, no problem.
Okay.
But
Or do you have
when
another time in mind?
no, that's fine. If you want to do morning, that's fine with me because I wake up at 4 o'clock in the morning to study. Uh, that's fine with me. If 7 p.m. go be fine with you, that's fine.
Okay. All right.
You let me know about that 3 days and Wednesday, Thursday, Friday. How you going to work with me?
All right. This is it, right? You know, I told you the other time. It's a 60-day program, right? But we only meet on Zoom 3 days in a week. So the
Oh,
remaining
okay.
four
I'm
days,
fine. I'm
all right.
fine.
So
Okay.
the remaining 4 days, you are still doing something, but you are using that period of time to study the content, and I'll be asking you questions every week.
Oh, okay. Okay. We meet 3 days of the week. That's me. I can meet with you Sunday, Monday, and Tuesday.
Yes, but the
Okay,
remaining four
fine.
days is not your free days. They are just days for you to keep on studying on your own
I
because you need to
know
study the
because
content.
yes, I know.
Okay, all right,
Okay. That's why I want to know 3 days of the week. Okay.
all right. Sound good then. Any other questions?
My question is another question. I just need to know the content and do my part, and I need to pass the test this year
Yeah,
for
for
sake of
sure.
for
If you,
sake of my kids.
yeah, definitely understand. You are definitely going to pass the exam. That I know for sure because the way I've created your program, right?
Uh-huh.
This was it, right?
Mm-hmm.
Initially, when I was creating the program, I had no clear plan, right? I was just doing teaching, and all that kind of stuff. Now, when I started having success, helping students pass the NCLEX exam, so somebody told me, why not put all these things together? Because now, it's not like a clue for helping students to pass the NCLEX exam. Now, this is it. A particular student failed the NCLEX exam 3 times,
Mm-hmm.
right? Our result was uh how would I say it? It's just like now, maybe her first test she had above the passing standard, management of care, and then her second test she had below the passing standard, third test she has below the passing standard for management of care. Now it was
Mm-hmm.
like a mixed result that I cannot really say how to help this particular student. Now, so I told myself that okay, let me just create a certain part that I feel should help the student pass. If it can help this particular student pass, then it's going to help any other person pass. Right, because there's no a clear area to say, okay, this lady is good in, right, in her test report. So I created this plan, I utilized it, and she passed the NCLEX exam in its 5 questions. She said she already knew that she passed the exam, even when she has not yet seen her result. So I put all these things together. I created video around it, teaching lecture around it, and I started utilizing it, and more other students were passing. To my biggest
Okay.
surprise, even a particular student who failed the NCLEX exam 14 times passed on her 15 attempts. And guess what? When this particular student failed the NCLEX exam on her 14th attempt, she said something to me. She said she's giving up. I said, why? She said she don't understand English. I said, where are you from? She says she's from Philippines. I said, oh, okay. Do you know that the NCLEX exam is not a test of what? English, but the NCLEX exam is a test of concept. The moment you can understand the concept behind the NCLEX exam, right? I don't mind even if it take you to pass the NCLEX exam in 150 question. Pass is a pass. Let's do this and let's pass. I'm going to walk you through. I walk this particular student through using the
Yeah,
three
because
core principles.
because I'm tired. I'm tired,
Yeah, yeah,
sir.
yeah, yeah. I definitely
I
understand. I
feel like
definitely understand.
I'm not lying to you. I get to a point I feel like whatever, and then I feel like give up
Mm. Don't, don't,
because
don't, don't give up.
I get to a point I say, had this person passing, I'm not passing. I had this person do it, I cannot do it the same way like them. It doesn't mean I'm going to make it. Like my kids say, "Mommy, you spending money by the program, but you never pass. Just say you never go make it."
Mm. Yeah,
And
this is the problem, right?
I need to pass it because my daughter say, "Mommy, I'm going to graduate high school. You still not go pass in class." Yes.
Wow. Well, I believe every student have the ability to pass. There's nothing that is stopping any student to pass. It's always these three things. For the past 2 years, I've been coaching, right? It's always these three things. One, the content. Two,
Yeah.
knowing how the NCLEX write the question. Three, understanding. The moment
Mm-hmm.
you can have these three things in your 75% ability, right, you are going to pass
Mm-hmm.
the NCLEX exam. I have no doubt. Right. So let's do this, right? And for sure, you'll be able to pass the NCLEX exam. That I can
Okay.
guarantee you.
Okay.
Right. That I can guarantee you. So any
Okay.
other question?
No, that's all.
All right. Okay. So in the absence of no question, right, I'm going to end the Zoom now,
Yeah,
and
that's fine.
I'm going to send you the NCLEX test plan and the NCLEX pass question so that you can have that document. I'm also going to send you two other documents as well too. That particular document is pharmacology document, right? It contains all the medication that have been tested on the NCLEX exam previously. And also I will
Okay.
send you your cheat list for safety and infection control because you are definitely going to see safety and infection control on the NCLEX exam. So I'm going to send you
Yeah.
that document as well too.
Last time all my test was infection control.
Yeah, it is definitely going to be on the exam, right? That is 13% of your exam. So obviously it's going to be on your exam. So I'm going to send that to you so that you can have that document, right? And be able to like study well. Okay?
Okay. Thank you.
All right, you're welcome.
Have a nice